Much.
Joining the meeting live from Capitol Hill in Washington, D.C., Congresswoman Marsha Blackburn, a Republican representing the great state of Tennessee. And Representative, welcome. Your thoughts on how good a job the president did in connecting with Republicans, period, last night?
I think the president connected with his base, and unfortunately, I didn't hear anything new from the president's speech last night. And of course, on Energy and Commerce Committee, we have been working through this issue for the past few months, and have had H.R. 3200 before us in committee.
You don't believe he did anything, however, beyond his base last night with that speech. Is that correct? With the Republicans.
I was hopeful that he was going to reach out and say, come on, let's start over and let's work together in a bipartisan manner. He is right to say that we need reform. I think we all agree that we need to reform some components of the health insurance market system. We need to deal with the cost. The cost is too high. But the promises that I have heard from this public option program are the same promises I heard in Tennessee with our public option. Those promises were broken, and that program nearly broke the state.
Yeah, isn't the problem that when you mandate an insurance mandate and a public option, but don't reform insurance practices, in other words, allow government to maintain anti-competitive structures so one or two insurance companies control the market, you basically are just mandating, as Howard Dean just suggested, giving billions to insurance companies. So in other words, without meaningful insurance reform, anything else becomes kind of silly.
And that should be the starting point. You have to look at the insurance market reforms, those with pre-existing and chronic conditions, and making sure that is dealt with, being certain that people who have insurance aren't dropped. You also have to make certain that you don't have a lot of cost shifting taking place between your hospitals and shifting that cost from public pay to those that are in private insurance. That is, the insurance market reforms have to be dealt with first and foremost.
Yeah, but it strikes me, and Ezra Klein is with us as well to keep the conversation that much more honest, if you will. Ezra, very familiar with all of the legislation. So, Ezra, I want to bring you in here, but it struck me that the president went straight at that. In other words, he went at the exchanges. He went at the competitive problem, which is why I wonder, Representative Blackburn, why you're not more satisfied with some of the rhetoric that the president offered up about creating more competitive health insurance.
And he talked about the public option. The problem there is this.
No, that's not my Representative. My question is, I know we talk about a lot of things, but what I'm saying is he offered very explicit rhetoric about health insurance reform. He talked about a national mandate. He talked about national exchanges. He talked about altering that. He talked about a tax or some sort of a penalty for those who would seek to charge too much for health insurance. Right. Was any of that satisfactory?
The problem there is the way you come at it. He comes at it with government control. I say let's go at it with